My name is Melissa Wallace. I am doing a research proposal. This is on lifestyle changes to treat ADHD. A little bit of summary of what I'm going to talk about is children who have been diagnosed with ADHD disorder have had an increase in taking medications from 4.8% in 2007 to 6.1% in 2011. The main treatment they have for ADHD is medication. Along with medication, you have side effects. ADHD treated with behavioral therapy alone or in combination could really help the outcome and effects to ADHD and how it's treated. According to the CDC, about 43% of children that are treated with medication alone, 13% receive the BT, the behavioral therapy alone, and 31% are treated with combination therapy. One of the literature reviews that was discussed that I went over was a study that was conducted by Arnold. He used zinc supplements for children with ADHD instead of using the amphetamine that's in most of the ADHD medication. Zinc deficiency has been linked to hyperactivity. The results were based on zinc levels in the body. The children taking zinc twice a day had an increase of 7% of long-term zinc nutrition, compared with half of what the children only taking zinc once a day, or none with children taking a placebo. With this study, the results were minimal and really didn't affect children in any way. The study pretty much overall failed. The study has been conducted again in the Mideast and was an actual success, so probably more studies need to be done on this one. My next lit review is, don't know how to pronounce his name. He conducted a study on parents that report oral sensory sensitivity and food preferences in ADHD. The study designed a 15 item inventory to measure oral oversensitivity and under response sensitivity behaviors. The study suggests that children with ADHD and higher oppositional behavior are more likely to be selective eaters and dislike toothpaste. Also, they can or cannot be picky eaters. The study showed that children with ADHD can be more sensitive to foods, obviously. My third lit review was about effects of an EPA and DHA on children with ADHD that had issues with literacy and behavior. Some of the methods that were used to assess the children were the Welcher Individual Achievement Test 3, Test of Everyday Attention for Children, and blood samples. The overall study showed no significant differences. They also did some fatty acid profiles that showed an increase in the DHA and improved work reading and better parent surveys of oppositional behavior. The study could benefit children with learning disabilities. It could also be beneficial to practice it now as well. My fourth lit review was conducted of a study ranging of the treatment of ADHD in a social setting of behavioral and pharmacological for children. Obviously, they focused on medication and behavioral modification together. It was actually a success and showed that low doses of stimulant are useful with behavioral modification. My fifth lit review study was completed to see the effects of restricted elimination diet on family structures in children with ADHD and ODD. The study was measured by questionnaires, different ones. It showed that there was no significant differences in family structure with children on the RED compared to the control group. So that leaves me with my PICO question. Would lifestyle modifications be more beneficial than pharmacological use in children with attention deficit hyperactivity disorder? This research is important because with pharmacological use, there are side effects. If this disorder can be treated with lifestyle modifications alone or with medication, this could change a lot of lives for the better. The main intervention used right now are the pharmacological, the amphetamines for children, but maybe using dietary supplements with behavioral modifications would definitely help. Obviously, a lot of the researches have not been too promising for behavior modification alone with ADHD. My theoretical framework, I used the nursing theory, the health promotion model by Pender. This model increases a patient's level of well-being. It increases the desired behavioral outcome by improving health and better quality of life. Not having to depend on medication alone to treat a disease can lead to a healthier life. Behavioral modification will play an important role in this research. This theory has three main idea areas: individual characteristics and experiences, behavior-specific cognitions and effect, and behavioral outcomes. Health promotion model's main areas of focus on the individual on how the person can adapt with their behavioral using modification. My design, setting, and sample for this research would be a quantitative experimental design. A control group and an experimental group along with the survey will be used to see if treatment of ADHD can use lifestyle changes alone. The control group will be participants who use a pharmacological means to treat ADHD. The experimental group will be the participants who change their lifestyle to treat ADHD and do not use any form of medication. The setting for this would be done outpatient. In about 8 months, we would select children from 8 to 15, male or female. The goal is to have at least 100 participants. The main criteria for selection: the child must have been diagnosed by a physician with ADHD. Obviously, we'll get an informed consent and written consent. The child's physician will need to be informed and willing to have their child participate in the survey and study. The child's teacher must be aware as well. Every month, the parents and teachers will be given a survey to fill out. The child will come into a facility monthly to get evaluated. The parents and children will be educated on the research study. They will understand the purpose of the research and will be told an expected duration of the child's participation. They will also be told the foreseeable risk and discomfort that can happen to the child. They'll be explained their rights, names, and personal information that will be confidential, and they'll be educated on the risk and benefits of this study. During this research study, the instruments that will be used will be a questionnaire, the Conners rating scale. It's a usual scale that's used for ADHD. It's a standardized tool across the United States. It has validity and reliability. The data analysis will be conducted for the study will be the parents' response to the Conners rating scale. The study will use t-tests to correlate between the control group and experimental group. The t-test will show statistical difference in control group and experimental. If the experimental group is statistically different than the control group, there should be more studies conducted and education to parents with children and ADHD. So my conclusion: ADHD uses medication alone as treatment. Using medications can cause adverse side effects. Although medications are used for treatment for diseases, they can cause more harm on the body. The concern is children taking medications daily and the harm that it can have on their bodies while they're still growing. By using behavioral modification for the treatment of ADHD medication, use can be eliminated or decreased. The study improves the children's outcomes with ADHD. And here are my references. Thank you.